A local issue from my home city where my constituents, Sam and Cecilia Glad, had a dog named Molly. And Molly suffers from chronic autoimmune disease, and they refused to get, they were refused a license by the local designated public health official because Molly was not able to receive a rabies vaccination. Molly's veterinarian said that the vaccine could have serious adverse effects or possibly kill the dog at this point. Currently, the existing law states that every dog owner, after his or her dog attains the age of 4 months, procure a rabies vaccination by a licensed veterinarian with canine anti-rabies vaccination. The vaccination is good for 3 years. State law does not allow for exemption. This bill will create exemption in state law for dogs whose lives would be endangered due to disease or other considerations. And put in perspective, we need to work on this number, but only about 25% of the dogs here in California are licensed to begin with. And this law would mandate that the animal be watched by their veterinarian, go for annual checkups, and would able to give them a year-by-year exemption from the vaccination while they're under doctor's care. A whole bunch of other provisions to help protect the public as well. You have to be on a leash, you have to be only with an adult, and those type of things, keep away from animals. But I have a couple witnesses that could also answer questions the committee may have. One of our sponsors, Lisa Lipperman, who's a veterinary student at Western State University of Health Sciences. And I also have Dr. Barbara Hodges, a state veterinarian license, as well as the Humane Society Veterinary Medical Association. At your convenience, I'd like them to have a brief testimony and ask any questions you may have.
Sure, by all means, good afternoon, welcome, and please proceed.
Okay. Good afternoon, Chairperson Hernandez and Senate Health Committee members, and thank you for the opportunity to speak to you today. I'm a third-year veterinary student at Western University of Health Sciences in Southern California. Because I'm a vet student, I understand the science behind and need for this bill. However, I'm also supporting this legislation because I loved my dog who recently passed away, and I need to help the people who love theirs and who face similar situations. When Max, my 11-year-old rescue, fell ill with an autoimmune disease, I knew that stimulating his already out-of-control immune system with a vaccine meant risking his life. When I attempted to follow the law and license Max, not only were we denied because both his veterinarian and I refused to give him the vaccine, we were warned that we could be cited as being in violation of the law. As the fear of breaking the law to save my best friend and my very best study partner overwhelmed me, we found Molly's bill. The vaccine directions clearly state that it is used for use in healthy animals only. Insisting that these dogs be vaccinated not only puts them at risk, it requires that we ask a veterinarian to commit malpractice and break their professional oath. As a future veterinarian, it is my responsibility to care about all the old, sick, and frail dogs in California. So I'm asking you to put the medical decisions in the hands of the veterinary medical professionals by joining us in supporting Molly's bill. Thank you.
Dr. Hodges.
Thank you. Good afternoon, and thank you for the opportunity to speak to you today. I'm Dr. Barbara Hodges. As a state-licensed veterinarian and a dog owner myself, I speak today on behalf of more than 400 California members of the Humane Society Veterinary Medical Association, a professional association focused on the health and welfare of animals. HSVMA is a sponsor of Assembly Bill 258, a measure establishing a safe, uniform, statewide mechanism for exemption from rabies vaccination for those dogs for whom the vaccination may be lethal. The California law governing rabies vaccination requirements, which is tied to dog licensing, does not reflect current scientific research showing that for a small but significant number of ill and immune-compromised dogs, vaccinations can be potentially harmful and even fatal. An additional issue is the attendant public safety risk, since the efficacy of vaccines given to ill and immune-compromised dogs is questionable, and owners may mistakenly think their dogs are protected against the disease. Under this bill, an exemption would be signed by a veterinarian familiar with such a dog's medical history, and the dog would be monitored by local public health officials. The California veterinary community supports selective exemption from rabies vaccination, and some local communities already accept waiver letters for licensing purposes. AB 258 would allow California veterinarians to provide the best possible care for our at-risk patients. We believe this is a critical health and welfare issue for California canines and their caregivers. We urge your support of this sensible measure. And might I say, Mr. Chairman, that we do want to thank you and your staff for the amendments that have been made to the bill. We do think that they improve the bill nicely.
Thank you very much. Anyone else like to speak in support?
Just very briefly, Mr. Chairman, members, Mike Dillon representing the California Veterinary Medical Association. We are in support, as been mentioned. Currently, veterinarians are technically breaking the law. But we think the bill has plenty of safeguards, and these amendments even add some stronger safeguards, and so we urge your support.
Okay, thank you.
Hi,
Next.
Jennifer Fearing on behalf of the Humane Society of the United States, also in support.
Thank you. Before we move on to anyone else that would like to speak in support, I want to just verify that you are prepared to take the amendments that were in the analysis.
Yes,
Let me just
Mr.
kind
Chair.
of go over them very briefly. Amendment number 1, which would specify that veterinarian must verify and document that a rabies vaccine would endanger the dog's life due to disease or other consideration. Number 2, clarify that the veterinarian must explain the inadvisability of the vaccine and the exemption from that CDPH will develop. And number 3, clarify that the license period for an unvaccinated dog cannot extend beyond 1 year. Is that correct?
Correct.
Okay, perfect. Is there anyone else like to speak on support of the measure? Is there any? Yes, you have a question. Senator Wolk.
It's my understanding from the bill that in these particular cases, the animal is essentially under house arrest.
There
Is
are
that
limiting factors for the animal as far as, well, the process go, the veterinarian write the letter, the county medical officer, the city medical officer have to approve of this arrangement. Instead of going to your vet every 3 years, it'd be on an annual basis. The dog has to be on a leash, has to be controlled by adult, can't be off its property. On those, it can't be touching another animal or near another animals. There's a whole set of barriers. And additionally, the local medical officer could also state other restrictions. We were hard-pressed not to put too many in the bill because we have such a diverse state. If you live on a ranch, it's going to be different than if you live in a downtown apartment building where you may have to take the dog out to go do its business out in the yard. So we're trying to leave that up to the local officials to see what's in the best public health interest at a local level, and those restrictions would be put on the exemption with the veterinary control.
Is there language, Mr. Chair, in the bill or Assembly member that says that a public health official may enact additional regulations as necessary?
They has to be upon approval, so that you cannot get this exemption unless the local actually approves the veterinarian's request on it.
But all those conditions that you
So they would have to be able to set those. There's certainly things that are already in there, like the leash.
Correct,
and those.
and whether there's a sentence in there that says, because of the uniqueness of their one county versus another, that the public health officer may add conditions as appropriate for a particular county?
I haven't looked at the exact language of that, but I don't know if there's exact language to that aspect, no. But they cannot get it without their approval, so I would be in the assumption of both the medical officer as well as the county medical officer to say these are the conditions we would do it under, so both have to agree upon that course for that animal. And we're talking about such a finite few that would even be qualified in the state.
Thank you.
Okay, is there any opposition to the measure? Is there any other further questions from any of the members? Unfortunately, we can't take a vote yet. We don't have a quorum. When we do, we will take the measure up, Assembly Member.
Appreciate your consideration
Would you
on
like
this.
to make a closing statement?
Just real briefly, I hopefully built enough checks and balances in here for the system. This practice has been ongoing to most the veterinarians, most counties that know that we were actually violating state law when they've been doing this over the last 20 or 30 years with these exemptions. This would basically clarify it. We'll be able to identify these animals and track them in case there's been no, I think it's been no instance in the last 10 years of rabies even cited in California from canines. So we hope that you approve this measure. Thank you very much.
Thank you.
Thank you.
Okay, I believe we're going by file item. Assemblymember Ma is in the room. We will do item number 3, AB 300, Safe Body Art Act. Good afternoon. How are you?
Thank you, members. I am back. Assembly Bill 300, the Safe Body Art Act, provides comprehensive statewide standards for tattooing, body piercing, and the application of permanent cosmetics in California. Since 1997, the number of body art practitioners has skyrocketed by over 400%. Since then, repeated calls from health practitioners, established body art practitioners, and the body art trade associations have been asking for stricter regulations and clarification on enforcement have gone unanswered. California still does not have enforceable statewide standards. And I'm going to have my witnesses self-introduce and speak on this, but the state requires that manicurists have 400 hours of training to be licensed. However, if you want to be a tattooist or a body piercer, you do not need any type of minimum training even to do that. So we believe this is an important bill. I am back here for the third time, and I'm going to have my witnesses introduce. Thank you.
Mr. Chair, members, Justin Malone on behalf of the local environmental health directors. We're one of 4 co-sponsors of this measure. It's ourselves, the health officers, and the industry themselves. The reason we bring it here is really to streamline a complex and a confusing plethora of local regulations that have different standards throughout the state, and we urge, for the sake of business equity and public health, that you pass this passage and we get it enacted as soon as possible. Thank you.
Thank you. Next.
Mr. Chairman and members, Barry Brokaw on behalf of the California chapters of the American Red Cross. We think this bill will expand a safe blood supply, and we need both in the state. Thank you very much.
Thank you.
Lydia Bourne, representing the Blood Centers of California. We are the 17 nonprofit blood centers found throughout the state, and as such provide over 90% of the blood and blood products. As my colleague mentioned, with this new licensure and inspection, we will be able to stop deferring patients based on the federal regulations, and so we are in strong support of this legislation.
Mr. Chairman and members, Mike Knutson here on behalf of StudX Corporation. We represent the ear-piercing industry. This bill has been gone over very carefully. It does a number of good things, both for public health and for those that are in the business, and we would strongly urge its support.
Thank you. Next.
Hi, Angelica Gonzalez with Kaiser Permanente. We think this is a good public health bill, and we're in strong support. Thank you.
Thank you.
Good afternoon. Leslie McFadden on behalf of the Sacramento County Board of Supervisors. This bill is going to be very beneficial and is very needed. Thank you, the author.
Nicole Wortelman on behalf of the City and County of San Francisco in support. San Francisco believes this will be especially helpful for temporary events that come to the city to ensure that their artists are licensed and trained.
Thank you very much.
Mr. Chairman and members, Betsy Armstrong on behalf of the County Health Executives Association. Our folks are the health department directors throughout the state in strong support and urge your support as well. Thank you.
Thank you.
Kelly Brooks with the California State Association of Counties. We're also in support.
Thank you.
Jerry Jeffrey, representing the California Hepatitis C Task Force, in support.
Thank you.
Michael Radigan on behalf of the Board of Supervisors, Santa Clara County, in support.
Thanks. Anyone else like to speak in support? Is there anyone in opposition? And I understand, Assembly Member, you have some amendments you proposed that you brought forward that we're willing to put into the bill. If you don't mind, we're going to go ahead and we've got a quorum, so we'll go ahead and take roll right now. Secretary, call the roll.
Senator Hernandez?
Here.
Hernandez here. Strickland? Here. Strickland here. Alquist? Anderson? Anderson here. Blakesley? De Leon? DeSaulnier? Rubio? Rubio here. Wolk? Wolk here.
We have a quorum. Please proceed. Is there anyone else in opposition? Is there any questions? We have a motion to move the bill. Is there any questions from any of the members? No questions. Would you like to close, Assembly Member?
Just respectfully ask for your aye vote.
Thank you. Secretary, this is a due pass as amended to public policy. Public safety, I'm sorry. And Secretary, call the roll.
Senator Hernandez?
Aye.
Hernandez, aye. Strickland? Aye. Strickland, aye. Alquist? Anderson? Aye. Anderson, aye. Blakesley? De Leon? DeSaulnier? Rubio? Aye. Rubio, aye. Wolk? Wolk, aye.
That bill has 5. We're going to still put that on call to let the absent members add on if they like. Thank you very much. And we're now to item number 4, AB 301.
Mr. Chair, can I move item number 2 that we already heard?
Sure. Real quickly, if you don't mind, we're going to go ahead. We have a motion to move AB 258, Hagman rabies vaccination motion. Senator Strickland. This is due pass as amended to appropriations with amendments. Secretary, call the roll.
Senator Hernandez?
Aye.
Hernandez, aye. Strickland? Aye. Strickland, aye. Alquist? Anderson? Anderson, I. Blakesley, DeLeon, DeSaulnier, Rubio. Rubio, I. Wolk. Wolk, I.
That has 5. We'll go ahead and put that bill on call and allow the absent members to add on at a later time.
Mr. Chair, do you want to move the consent calendar?
Why don't we do it after this, if you don't mind, because I don't want to have them wait any longer. Good
Always
morning.
at your pleasure.
No, good morning, Assembly Member. I saw you got here earlier, and I didn't want to. I knew you were first, but we have to go by file order, and I don't want to have you wait any longer than you have to. But Assembly Member Dr. Pan, good afternoon. Welcome, and how are you?
All right, doing well. Thank
and we're
you.
in item number 4, AB 301, Medi-Cal Managed Care.
All right, thank you, Senator Dr. Hernandez and members of the committee. I'm here to present AB 301. First, it pleases the chair, just as a matter of housekeeping, let me begin by accepting the amendments recommended by the committee staff to reflect an analysis to change the proposed date of the sunset extension from January 1st, 2018 to July 1st, 2016. I'm also committed to working on amendments to develop intent language that addresses the relationship between the potential transition of the CCS program carve-out and pilots being conducted to evaluate the efficacy of the carve-out. With that, Senators, I want to present to you AB 301, a simple yet critical measure for ensuring the continuum of care is maintained for children receiving very specialized care in the California Children's Services Program, known as CCS. The CCS has been an important partnership with managed care plans to protect children with very complex catastrophic health conditions. These include congenital heart disease, cancer, cleft palate, premature birth, and other life-threatening conditions that depend on the CCS program for access to high-quality care and pediatric specialists. In fact, in 1994, concerns that children transferred out of CCS into Medi-Cal managed care would fail to receive the same quality of care they had received through CCS, and so the legislature carved out CCS-eligible conditions for children who are enrolled in Medi-Cal managed care. This carve-out contained a sunset, which has subsequently been extended 4 times since being created, most recently in 2006. AB 301 would again extend the sunset out to July 2016 as the proposed amended. This bill is sponsored by a coalition of groups, including the American Academy of Pediatrics, the California Children's Hospital, and the California Specialty Care Coalition. So I have here with me today to testify in support of the bill, Aaron Givens with the Children's Specialty Care Coalition.
Thank you, Dr. Pan, and please proceed with those in support.
Mr. Chair and members, Tim Shannon representing the Children's Specialty Care Coalition. As the author notes, we are one of the co-sponsors of the bill, and I'd like to introduce Aaron Auber Givens, who's the Executive Director of our coalition. Thank you.
Welcome.
Hi, Aaron Givens on behalf of the Children's Specialty Care Coalition. We represent pediatric subspecialists in California who take care of children at the CCS centers here in strong support and would be happy to answer any questions.
Thank you very much.
Mr. Chairman, members, Randy Perry there and Reed and Associates on behalf of the California Children's Hospitals Association, strong support and co-sponsors of the bill. We represent some of the most vulnerable children in the state, and CCS is a very, very integral part of that coverage.
Thank you very much.
Thank you, Mr. Chair, members of the committee. Carolyn Jenna with the California Medical Association, also in strong support. These are our sickest kids, and it is critical that they maintain access to the providers they've been seeing. So thank you. We urge your support.
Thank you very much. Next.
Mr. Chair and members, Terry Calgar-Hill on behalf of Children's Hospital Oakland, as well as the Hemophilia Council of California, in strong support.
Thank you. Is there anyone else in support? Is there any questions from any of the members?
Question.
Yes, Senator Wolk.
Dr. Pan,
Yes.
just want to make certain, when this was originally done, that the COs were exempted from this situation, so because they have programs that are actually quite good at my district, so COs are still exempted from the extension. Nothing's changed.
Yeah, so that we're just extending the sunset, so the
Thank you
current
very much.
situation will not change.
That's all I need to know. Thanks. Good bill.
Thank you.
I'll move the bill.
Okay, we have a motion to move the bill by Senator Wolk. Is there anyone in opposition? No further questions from any of the members. Would you like to close?
I respectfully ask your aye vote. Thank you.
Thank you very much. We have a due pass as amended to appropriations, AB 301. Secretary, call the roll.
Senator Hernandez.
Aye.
Hernandez, aye. Strickland. Aye. Strickland, aye. Alquist. Anderson. Aye. Anderson, aye. Blakesley. Aye. Blakesley, aye. De Leon. DeSaulnier. Aye. DeSaulnier, aye. Rubio. Aye. Rubio, aye. Wolk.
Aye.
Wolk, aye.
We have 7. We'll put that bill on call to make sure to allow others to add on later on. Thank you very much. Have a good afternoon. Thanks. Okay, we're at item number 5, AB. Well, you know what, before we go on to item, come on up anyway, but before we go on to item 5, we're going to go ahead and move the consent calendar.
So moved, Mr. Chair.
We have, hold on, real quickly, we have item number 1, 6, and 7. However, file item number 6 and 7, AB 1014 and AB 1394, both have amendments, therefore we're outlining the analysis. If there's no objections, we'll temporarily take those bills off the consent, accept the amendments, and then place the bills back on. If that's okay with everyone? Ask a motion to adopt the consent calendar. So moves. Okay. Senator Wolk, we have the consent calendar. Secretary, call the roll.
Senator Hernandez.
Aye.
Hernandez, aye. Strickland.
Aye.
Strickland, aye. Alquist. Anderson. Anderson, aye. Blakesley. Blakesley, aye. De Leon. DeSaulnier. DeSaulnier, aye. Rubio. Rubio, aye. Wolk. Wolk, aye.
We have 7. We'll go ahead and put that back on call and to allow the absent members to add on. We're now down to our final bill, item number 5, AB 673. Assemblymember, welcome. I believe you're going to be presenting on behalf of Speaker Perez. Is that correct?
Correct.
Welcome.
Thank you. Thank you, Senator and committee members. On behalf of Senate Speaker Perez, I'm pleased to present AB 673, which would integrate health issues affecting the LGBT communities as part of the mission of the State Office of Multicultural Health. The Office of Multicultural Health's mission is to increase the capacity of the department's public health and healthcare services to reduce gaps and improve healthcare provisions among and access among the state's diverse population groups, particularly among racial and ethnic communities, expanding the office's mission to include LGBT Californians will help the state develop and implement more comprehensive health policies that benefit California's diverse populations. I respectfully ask for your aye vote.
Thank you. Is there anyone who'd like to speak in support of the measure? Is there any questions from any of the members? We have a motion to move the bill. Senator Wolk, is there anyone, did I say opposition? Is there any opposition? Okay, seeing none. This is a due pass to appropriations, AB 673. Perez, please call the roll.
Senator Hernandez.
Aye.
Hernandez, aye. Strickland.
Yes.
Strickland, no. Alquist. Anderson.
Nope.
Anderson, no. Blakesley.
Nope.
Blakesley, no. De Leon. DeSaulnier. DeSaulnier, aye. Rubio. Rubio, aye. Wolk. Wolk, aye.
That has 4-3. We'll put the measure on call and allow the absent members to add on.
Thanks, sir.
Thanks, Assemblymember. Have a good afternoon. Then yeah. Okay, we're going to lift the call on all the bills and then put them back on call to allow Senator Blakesley to add on.
Thank you for your help.
We're going to start off with the consent calendar, due past appropriations. Call the absent members.
Senator Alquist, De Leon,
Put that one back on call. We're on item number 2, AB 258, Hagman. Call the absent members. Due pass as appropriation to due pass as amended to appropriations.
Senator Alquist, Blakesley.
Aye.
Blakesley, aye. De Leon,
We'll put that back on call. Item number 3, it's AB 300, due pass as amended to public safety. Call the absent members.
Senator Alquist, Blakesley.
Aye.
Blakesley, aye. De Leon,
Okay, we'll put that back on call. Item number 4, AB 310. Item number 4, AB 301, Medi-Cal managed care, due pass as amended to appropriations. Call the absent members.
Senator Alquist, De Leon,
Okay, item number 5, AB 673. You voted for that one already, I thought.
I voted for that, yes, I did.
Yeah. Call the absent members.
Senator Alquist, De Leon,
Okay, we'll put that back on call. I think you got everything.
Did
Did I miss anything? Thank you so much. I was on all of those. I just walked in 2 minutes ago. But if you got me.
Well, we lifted everything.
I'm sorry. You know what? We're going to.
Okay.
We're doing it first.
Okay, we're going to lift the call for item number 2, AB 258, Hagman. Call the absent members.
Senator Alquist, De Leon, DeSaulnier. DeSaulnier, aye.
We'll put that back on call. Item number 3, AB 300, Ma, due pass is amended to public safety. Call the absent members.
Senator Alquist, De Leon, DeSaulnier. DeSaulnier, aye.
That has 7. We'll put that back on call. Okay, we're going to lift the calls. We've got the consent item. Call the absent members.
Senator Alquist. Aye. Alquist, aye. De Leon. Aye. De Leon, aye.
That's 9-0. The measure's out. We're going to be item number 2, AB 258, due pass as amended to appropriations. It's currently 7-0. Call the absent members.
Senator Alquist. Aye. Alquist, aye. De Leon. Aye. De Leon, aye. 9-0.
That's 9-0. That measure is out. Item number 3, AB 300, due pass as amended to public safety. It's currently 7-0. Call the absent members.
Senator Alquist. Aye. Alquist, aye. De Leon. Aye. De Leon, aye.
That's 9-0. That measure is out. We're item number 4, AB 301, due pass as amended to appropriations. Call the absent members. It's currently 7-0.
Senator Alquist. Aye. Alquist, aye. De Leon. Aye. De Leon, aye.
That measure is out. It's 9-0. Item number 5, we're lift a call, AB 673, due pass to appropriations. Call the absent members. It's currently 4-3.
Senator Alquist. Aye. Alquist, aye. De Leon. Aye. De Leon, aye.
That's 6-3. That measure passes. Measure's out. Thank you. And
Thank you.
no further business in front of the committee. We will be adjourned.